In this presentation, we're going to have a look at how we're going to prepare the students for practical teaching sessions. It's easy to understand how a student might feel quite anxious about coming into a practical teaching session when they've got absolutely no idea what it is we're going to be covering. I personally think it's important that they should be given some self-directed learning beforehand. And the self-directed learning might include something like going on to a clinic or going into a practical session with other students to watch what they're doing, so that they've got a clear idea of what's going to be expected of them at the end. This can be a bit daunting because obviously what they're seeing is being done in real time by people who have become professional, or at least fairly well competent in the skills that we're asking them to learn. But I do think that there is a role for giving them some instruction prior to them coming in to a clinical session. And obviously we've got a couple of clinical sessions to consider. For most of the students that we'll be working with, we're talking about giving them something in theory or some observational time where they can go and see what it's going to be like when they do it. And then we're going to do a preclinical session, which might mean working on for example, in dentistry on phantom heads, or it might mean working on simulators for other kinds of clinical practice that they might be doing. And then finally, once they've become fairly well competent in the skills that we're asking them to do in the simulation room, then we can take them on to patients and ask them to do it there under close supervision, obviously, to begin with. So the part that I'm going to focus on just now is the preclinical bit. So in other words, how do we prepare them for getting ready to come into the clinical skills sessions, which they would then do prior to going on to the clinic? So the objectives really that we're aiming for at the end of this session is to say that you should be able to explain Gagny's model of instruction. I'll explain that a whole lot more in more detail later on. We're going to look at the components of preclinical preparation, and then we're going to look at how to have the preclinical preparation so that it helps the students when they attend for their clinical skills practical sessions. So let's have a look more closely at Gagny's model. You'll see from the dates that it's fairly recently that this has been looked at again, and this time it's by an author called Kulata. And Kulata has compiled a very neat summary of Gagny's approach to learning, which reflects our aims for the clinical skills teaching. And the theory that he outlines has 9 instructional events. So we'll go through each one of these, and then you'll see that while we can use these instructional events for any lesson that we're providing, you can see why clearly it helps in a preclinical situation, and then we can move the whole model into the clinical situation too. So when we first meet our students in this teaching session, we need to get the students into a situation where they're ready to learn. So first of all, we have gaining information or reception. And you might do this by going on to the clinical skills session beforehand and saying, okay, today we're going to do some wonderful things with the simulators that we've got, and here's what we're going to produce at the end of it. So you're getting them excited, you're laying down the rules for what it is they're going to achieve at the end of the day. In other words, you're giving them their objectives. Let's keep this session that we're describing here to the pre-clinical self-directed learning that we want the students to do before we come with them face-to-face in the simulation room. The gaining information is still the same no matter where you meet them. So when you present your self-directed learning or your theory work or the stuff that you want them to read or look at prior to coming into the session, you need to get them inspired. Another way that you might choose to do this is maybe by providing them a video recording of what it is they're going to be doing, so that they've got the chance to have a look at it and become familiar with it. And that would really get their attention going. So we need to inform the learners of the objectives, and this is described as their expectancy. What do they expect to achieve at the end of the session? And by looking at a video, I think this is a very, very good way of doing that. We need to stimulate the recall of prior learning, and so you may present a couple of questions to the students. This can be in the video as well, which you just ask them to pose a question and then give them the answer to. Or the video might show them some ways of doing something maybe the correct way, a very slow way, and then a very poor way, and they can discuss amongst themselves what they think the differences are between the scenarios that have been posed. But certainly for any self-directed learning, I think we have to ask the students to recall what they've learned previously and then set themselves up ready for the next learning session. We're going to present the stimulus. In other words, we're going to give them the instruction that we want them to do at the end of it, or really just showing them exactly what it is we want them to do. We're going to provide the learners with guidance. In other words, we're going to point them in the right direction and make sure that they understand what's the right way, what's the wrong way, and what we want them to do with it. But also, maybe if you're giving them some self-directed learning, is not to let them go way off on a tangent and read a whole lot of stuff that really isn't relevant to what they're doing at the moment. Once they get into the clinical skills room, we'll be asking them to elicit their performance. In other words, they're going to have to do what we've shown them. And then we're going to provide them with feedback. Good feedback, poor feedback, but certainly we want to consider that to be feed forward, what you're going to do the next time when you do it. We're going to assess their performance, tell them whether it's good, bad, or indifferent. So you also, as well as giving feedback, you need to then say, here's where you stand at the moment, so that they've got a very clear understanding of where they are. And then we need to repeat it and repeat it and repeat it in order to enhance retention and transfer, so that they're actually managing to put this into practice. You'll see, having read through the list of this, that there are some things that stand up very well to be used as self-directed learning or preparatory learning, and some of it that actually has to be done once they come into the clinical skills simulation room with us. But this list of instructional events should provide the necessary conditions for learning and serve as a basis for designing instruction. So if we were to follow this order, it would certainly help us very well as teachers. You'll see from this slide that this model of teaching has been used by a number of different authors. In 2011, Kanjul et al. Discusses the use of the model to teach psychomotor skills in doctors. So what I'm trying to emphasize here is that this tool is used often for medical education. Now, these authors have changed the wording slightly, but it basically is exactly the same thing. So let's just have a look at these. Gaining attention again, getting the students on board prior to actually starting the session, make sure they're really focused on what it is they're going to be doing. Informing the learners of the objective, or objectives I would say, as normally there are more than just the one. We want to ensure that they've got prerequisite learning, and it doesn't matter which teaching session it is you're working from. You need to take the students from what they know to what they don't know, give them the security of starting off in a known area of their learning and move them into something that they're a little bit less sure of. Presenting the stimulus material, once again, a complicated way of showing them what we're going to be doing. Provide the learning guidance. Quite often this is broken down into where presenting the stimulus is shown in real time. Providing the learning guidance, it tends to be broken down into a series of component points that the student can follow a little bit more easily. Having shown, we now want the students to do, so you recognise that as being tell, show, do. At this point, we're asking the students to elicit the performance or do what we've asked them to do. Again, providing feedback on how well it's been. Assessing the performance becomes a grade, whether it's a pass or a fail, for example. And then we need to enhance the retention and transfer. So not only asking them to repeat it again until it gets better, but be able to transfer that learning into another clinical situation. For us in this situation, we'd be looking at the students learning a skill on the simulator and then being able to transfer that skill onto the clinic. So it is clear that following the format that Gagnon prescribes will provide a successful lesson plan. It's also clear that when the students meet you in the clinical skills lab for the first time, all the events of instruction will need to be followed. We'll return to this when we look at the delivery of the face-to-face clinical session. But this presentation explains how to prepare the students for the clinical skills session so that they arrive prepared to undertake the instruction in these skills. So for the purposes of a clinical skills session, this presentation will focus on the use of the first 4 points only. And this is because I want you to think about this as preparation for a clinical skills session. I'm not saying we won't repeat them again once the clinical skills session begins, but you'll see I've divided the order, or I've divided the number of component parts of this preparation into 2. So the focus of this presentation is going to be about this preclinical part, in other words, preparing the students to come in for clinical skills. In this, we need to still gain their attention. I've suggested using maybe a video, but it can just be the written word. It doesn't matter how we do it, but it is important to do it. Again, we need to inform the learners of the objective. Obviously, another thing that we will do on the session when they come in to see it, but as prior preparation, I think this is good too. We want to stimulate recall of prerequisite learning. Yes, I think you do need to go back and say, think about all the things that we've done in the past that have got you to this point, and all the groundwork that we've done in order that you come in here and manage to do this correctly. And then we want to present the stimulus material. Here it might be a very close video that you do, something very much focused down into the very intricate clinical skill that you're trying to achieve, that you could stop every now and again and point out features of so the student really understands. And then we're going to provide learning guidance, and this might be that the students are asked to go onto a clinic to watch it being done. It might be that you're directing them to some books that you want them to read, or it might be some research to build up the evidence base for these techniques that we're going to carry out. And then indicated on the right hand side of the slide, we're going to reserve the rest of the list for the actual clinical skills practical session. And this is because I don't feel that in a self-directed learning prior to coming into this session, we should be expecting the student to either be able to do it or elicit the performance. We shouldn't need to give them any feedback because they're not doing anything, and we wouldn't assess their performance, but there's no reason for not assessing their knowledge prior to coming in. You'll be finding that I'm repeating myself over the next few slides, but repetition isn't any bad thing. In your minds, you'll be thinking, yes, I remember what the list was that we've just been given. But let me just go through in each one in detail, and then you should have a complete understanding of what we're trying to achieve by the end of this. So for the first, which was, if you remember, gaining attention, we're going to present the material to the student prior to the clinical skills session. It can be so daunting. Any guidance information that can be given to prepare them will reduce the anxiety the students feel. And I think that's really important. It can be so anxiety provoking coming into a clinical skills session because you know that you're going to have to perform, and you know that somebody's going to be watching over your shoulder to see what you're doing. So anything that can be done to reduce that, and familiarity is one of the things that reduces anxiety. The more they know about something, the less anxious they'll feel. It doesn't take away from the fact that they still have to perform, but a certain understanding about what's going to happen will help make them feel very much better. You need to arouse their attention by providing interesting material for them to view as they're self-directed learning. I've given you the example that it could be a video of what they're just about to do. It can be quick or detailed, and you can zoom in for the details so the students will be able to look at it, pause it, and review it in their own time. And I think that's really important. You could put in some additional questions strategically placed throughout the session so that the video plays it will encourage the student into deeper learning rather than surface follow the instruction type learning. I've repeated over a number of times that it's really important that we tell the students what the objectives are for the lesson that they're just about to undertake. We always want to start each of our lesson plans with the objectives, and these should state, at the end of this session, you will be able to. This keeps it very clear in your mind that it's not what the teacher's doing, it's what the student needs to have done by the end of it. So the words that we use for the objectives have to be words that we can use for evaluation, such as explain, demonstrate, discuss, but something like to know, to understand, these are not good objective words, and they're certainly not any good for a practical session. We have to be able to see that the students can do what we're asking them to do and to be able to evaluate it. So with this particular teaching session, one of the outcomes should be you will be able to attend the clinical skills session with a clear understanding of the purposes of the skill, the components required to complete the skill, the order of these components, and the expected result of the intervention you are to carry out. I'd suggest that's a really good preclinical session. So we're looking at the objectives that we need to set for self-directed learning when the students are at home, away doing their own study time, and they're wanting to know what they're going to be doing when they come into the clinical skills session. They want to know how to prepare for it. So for me, these are the kind of things that we would want a student to come in the door of the clinical skills simulation room prepared, ready to do. And this is what we would hope for the outcomes of a self-directed learning to be. So as this is preparatory instruction, you will not expect them to carry out the skill at this time, which means that the rest of the list of categories of this lesson that we're looking at can be omitted at this time because we don't want them to actually carry out the skill. When you're looking at putting together this self-directed learning for a clinical or a practical session, this is probably the most important point. You want to stimulate recall of their prerequisite learning. You need them to be able to address all the stuff that they've learned prior to coming to this session in readiness for basically picking up the tools and getting on with the practical demonstration. We shouldn't have to be going back over work that we've done before at this point. The students should be bringing all that information, all that knowledge to the forefront of their mind so that they get the very most that they possibly can out of the clinical skills session when they walk in the door. So for me, this stimulating recall of prerequisite learning is the crux of this particular teaching material that we're talking about here. The students need to build on what they know, but you can also introduce new concepts at this point. You can ask them questions about previous observations of experience or relevant anatomy. If we look back at the study from 2011, in dentistry, that might be something like asking them to recall everything they've learned about tooth morphology. So this really is the grounding for what they're going to be doing when they come in to do the practical demonstration. We can't expect them to pick up, say for example, a syringe and be able to give an injection without understanding the anatomy of where it is that injection is going to go and what it's going to do. So all that prerequisite learning needs to be at the forefront of their memories before they move into this session. During the self-directed learning for this preclinical session, this simulation session, I'd suggest that it is important that in some way you try to present the stimulus material to the student. As I say, I think video is probably the best option, really, just get somebody to video record what you want them to do. Doing it yourself if you wish, and you can voice over it too so that they can hear what you're trying to do at the same time as doing it. But in order to prepare the students for what they're going to be doing practically, you need to introduce all the practical elements to them. For example, it might be clinical equipment, which you might want to take to bits. Let's just think about the syringe I mentioned earlier. You might want to take the syringe apart to its component parts and then put it all together again so that they fully understand the equipment that they're going to be using on their patients. Back to the 2011 paper again, just quoting from that, saying the content should be organised, meaningful and explained and demonstrated using a variety of media. I'd suggest that you can use the videos, but you might want to use stills, that you can put labels on or diagram representations of things so that they understand better. We could ask a patient to give you a transcript of how it feels to have that particular procedure done on them, such as giving local anaesthetic, so that the student understands where the patients are coming from. There's lots of things that we can put into this pre-session in order that the student understands a whole lot better what it is we want them to do practically. But no matter what we do, once we actually get them into the room, we're going to have to go back over all of this again to make sure that they do understand it in almost a three-dimensional room, rather than just being on a virtual learning environment, such as giving them a video or something like that. Here's some things that can help when you're teaching the students. Show them what appropriate actions constitute correct performance. In other words, do it correctly. You can, once you've done that, do something incorrectly or do it too quickly or too slowly, and maybe allow the student the opportunity to send you some feedback that you could then read and mark, for want of a better word, or provide feedback on what they think the differences are and which constitutes the better and which the worse. You can give additional suggestions about how to make things easier, both for for them and possibly the patients. Use of examples is very good. I've given you some examples already, and how I'm trying to demonstrate how we can teach and different examples to use to make it better. You need to do the same for when you're trying to teach students too. We can provide case studies. I've suggested maybe asking patients to give some feedback on how they feel procedures feel for them. Graphical presentations. You can draw diagrams, try and make it easier. Some people are a little bit more visual learners than they are just being able to listen to what we're saying, so graphic representation might help. Mnemonics to help learners encode the information for long-term storage, particularly in things that come in an order, where you've got a list of things to do, then you've got almost a checklist, and it can be done in that way. It makes it easier for them. But no matter what, the students need to observe what you're doing. They need to have step-by-step explanations, and useful tips that you find help can be included too. So that brings us to the end of this presentation. It's fairly straightforward, but I do think that we need to understand where authors such as Gagnon comes from when they provide us with a list of, or almost a checklist of guidance of how to prepare these types of lessons for students. But for me, I think we really need to be very clear about what we want the students to do before we actually see them in the simulation room. They have to come in with some background understanding. They have to come in with some idea about what it is we're going to be doing and why we're going to be doing it, because you can't spend half of your clinical skills time teaching the theory of why we're here back from basics again. It's not a good use of time. So the references are there, interesting reading. Certainly, if you go to have a look at Gagnet's learning methods, then I think it's worthwhile just reading a little bit more around him as a particular author. Thank you.